Very proud of it, but a little concerned now for the way our retirees are being treated.
Today on National Law Enforcement Appreciation Day, thousands of first responders are being honored. At the same time, their benefits and health care plans are changing, and that change is confusing for retirees and current first responders.
And 9 on your side's Paulo Soro breaks it down for us.
This is me right there.
In 2012, Cindy Combs retired from the Cincinnati Police Department as an assistant chief.
Great career.
Now, almost 7 years later, Combs, along with 8,000 other retired Ohio first responders who are not old enough for Medicare, are dealing with big health care changes.
Our pension system decided this year to take us away from a group plan and put us with a broker who has a very questionable history.
That's because of cuts in medical coverage from the Ohio Police and Fire Pension Fund. In exchange, the organization says it has provided stipends to retirees, but some say that's not enough.
Plans went from a PPO to an HMO, so the coverage is much less. The premiums are higher. The deductibles are much higher. Prescription costs are incredibly higher. It could cost us, just myself, an additional $20,000 a year as compared to what I was paying.
In addition to higher costs, she says another problem has to do with fewer options to receive care.
The only in-network hospital is Christ Hospital. I don't have anything against Christ Hospital, but Good Sam and University are your trauma hospitals.
This will also affect first responders currently working, like Mount Healthy Chief Vince DeMasi, who worked with Combs in the past.
For people that have served their communities for 25, 30 years, to be basically kicked to the curb like that is just unconscionable. And I don't know how the people in Columbus sleep at night, but this is a tragedy.
Chief DeMasi, who also served 4 years as president of the Fraternal Order of Police, sent letters like this one to state representatives and only got a reply from Bill Seitz.
Grandfather people in. The people that have not yet retired have an opportunity to invest in like a health savings account.
We reached out to the Ohio Police and Fire Pension Fund, which said this had to be done or its health care fund would have been exhausted within 7 to 9 years.
It just became too expensive. There is no dedicated funding stream for retiree health care.
Spokesperson Daniel Graham says 28,000 retired Ohio first responders in their system will be affected.
90% of our Medicare eligible people enrolled in a plan, and 70% of our people that were under 65 enrolled in a plan, which is above our projection.
Meanwhile, Chief DeMasi plans to continue meeting with Representative Seitz to make changes happen. Paulo Soro, 9 on your side.